and welcome to Caregivers First, a show brought to you by SCAN, the Social Community Activities Network. SCAN is a nonprofit agency dedicated to helping active adults stay informed, empowered, and inspired. I am your host, Lynette Whitman, and I am the Executive Director of Caregiver Volunteers of Central Jersey. Today, we are going to be talking about a topic that I believe is so important and one that every caregiver can relate to: managing the experience of your loved one during a hospital stay. My guest today is Beth Suereth, who is the founder of a wonderful company called Caregiving Pathways. Beth lovingly cared for her elderly father through 5 years of hospitalizations, dementia, and diabetes. She is passionate about sharing the expertise that kept him out of the hospital through his cancer and the entire last year of his life. As a result of her experience, Beth became a certified caregiving consultant and now teaches family members how to manage a loved one's hospital experience, and also works with healthcare systems. Welcome, Beth. Thank you so much for joining me today.
Well, thank you for having me, Lynette.
So Caregiving Pathways sounds like a wonderful company. Tell me how you started it, what motivated you to get started?
Sure. So my father was in and out of hospitals for 4 years of the 5 years that I was a caregiver for him. And from the beginning, at the beginning, I didn't realize that as a family member, I had a role. I thought I was the dutiful daughter at the bedside and proceeded accordingly until I learned about all the things that I could do to help with the hospital stay and help get my father out faster and have better outcomes. And so I took my marketing background and that experience, put them together, and decided to start a company to teach family caregivers the information I wish somebody had given me when I first arrived at the hospital with my father.
That's wonderful, because it is so overwhelming, and you feel overwhelmed by what's going on. You feel like, can you speak up? Can you not speak up? Who should you talk to? So it's something that we all struggle with as caregivers. Is there something you wish you knew now, as far as when your dad first went into the hospital? Is there something that you would have prepared differently or had in place even before that happened?
Yes, actually, and even the things my dad did have in place, for example, his living will and legal documents expressing his wishes. I didn't realize that I would need to have them in my pocketbook at all times, because even when I put them on file at the hospital, something I learned eventually to do, I realized that a lot of people didn't have immediate access to that information. And so I would always carry his living will and eventually a DNR, a do not resuscitate order, so that everyone was clear. And my father was right, 100% on board that we should share these documents. And so you can prepare your documentation. You can prepare your family so that it's clear who will help manage the hospital stay itself. So, and that may or may not be the same person who will help with recovery at home afterward.
Right.
So if you can sort of designate a person to be the coordinator of the family beforehand, so it's clear who will do what when, how, who will notify others, that type of thing. And then to sort of have a loose plan for who would take care of mom or dad or whoever after discharge. And to think about the unfortunate event if somebody can't go home, and then where would, how would care be provided, where would that happen? So lots of things to think about, talk about with the family, and sort of just, even if you don't make decisions, just to have everybody thinking about it.
Right.
And the reason that one of the reasons it's so helpful to do that is because when a crisis hits and a family member is in the hospital, you're dealing with shock crisis mode, and to try to think through those decisions at a time when you're in a crisis mode is very difficult, and you may not make the same choices you would have if you'd had more time to think about it and process it and talk about it with everyone in the family.
It's such great advice, just to have those conversations with people before, your family members, before you are in crisis, because then you're just reacting. You're not making the best decisions potentially.
Right.
So let's say, so you're prepared, and then your loved one is in the hospital. Your loved one goes through the ER, and then they're admitted into the hospital. What are your top tips for caregivers to take back some of that control or to manage that situation? What advice do you have for caregivers once they're in a hospital?
Well, once you're in the hospital, the greatest thing that you can do is let people know that you are the family caregiver, that you'd like to be involved in decisions about the care that's going to be delivered. And you really have to tell everybody you encounter along the way about that, just a very short version, and that lets people know to include you in the conversation about the care.
So the nurse comes in, the 3 to 11 o'clock nurse comes in, and you're there, and you say, "Hi, my name is Beth. I am the caregiver for my dad. I want to be included in decisions." Pretty much that's how it goes?
Pretty much.
Yeah.
And you know, definitely include the patient, in this case my dad, and have him, you know, because the nurse will look to the patient to say, you know, is that correct? Is that fine with you? Because some people will say that, and the patient may say, no. It's sort of one of those.
Do they write that in the chart? Can they write that on the chart or in the chart, or that's not really effective to do that?
Well, actually, there's something called the CARE Act that AARP has been has passed in 39 states and territories, where the hospital is required to take the name and contact information for a family caregiver to help prepare that person for the care at home after discharge. And so more and more that information will be collected and added to the chart. It sometimes happens, it sometimes doesn't, depending on whether you came through the emergency room or not, if you were admitted, you know, directly. So that varies, but I absolutely encourage people to offer it to everyone, you know, the nurse on that shift, the nurse on the next shift.
Okay. And you touched on this a little bit. So let's say you have 3 siblings and you're all going to take turns in the hospital. It's important to designate one person as the spokesperson. So if you're there and then your sister Susie is there, Susie shouldn't say, "I'm the caregiver, I want to know everything." It should be, talk to us about that.
Sure. Yeah. Ideally, it will be one family member, and that person will be clear that, and all the other family members will have agreed that yes, this is going to be the primary person. Often that will be the person who can spend the most time there and collect the most information and coordinate information among different people in the hospital setting and different members of the family. And if there are other family members who will be possibly equally involved, for example, my sister Claire and I were really completely equally involved, and we would tell people, nurses, doctors, together, that we're the family caregivers for my dad. You can talk to either one of us about. So, you know, you make a plan with your family, however your family dynamics work, however availability of family members may work, but just to have a plan and communicate that same plan effectively throughout.
Okay, so tip number 1 is designate a primary caregiver. Tell all the staff members, "I'm the caregiver. Dad agrees to this. I want to be involved."
Exactly.
Okay, tip number 2. What's your second tip?
Sure. Tip number 2 is tell the staff about the patient's health goals. So different people at different stages of their life, different stages of their condition management may have very different goals. And so to be clear about what those are, that helps inform the care plan. So if your dad really wants to get back to running the marathon, and I know an 87-year-old man that runs a marathon, then you want to be clear that whatever the care plan is, that's the ultimate goal. And if the ultimate goal is just that dad would like to be able to go home and eat ice cream and watch football, then we want to make sure that you're aiming for that.
And talk a little bit about why that's so important. Because the staff might think, oh, we got to get him to run a marathon, or the staff might think he just wants to go home and eat ice cream and we're not going to give him rehab. Why is explaining that to the staff so important?
So it will affect the care plan. So for example, if my dad needed surgery for his knee, then if he wanted to get back into marathon condition, you might have a different approach to knee surgery than if he just was planning to go home and sit on the couch and watch TV, because maybe he had 4 other conditions that really weren't going to allow him to do much.
Right.
So you would approach a knee surgery a little bit differently if you expected marathon running results versus going home and not running a marathon.
And that's a great tip, because it also opens the conversation with your parent that so many people don't have. What do you want? What's your goals here? And also, I think, even between siblings, one sibling might think, oh, Dad's going to run a marathon again, and the other sibling is like, no, he really doesn't want to. So that opens that discussion up for so many people as well.
It does, and it opens the sort of further discussion of, okay, so for the rest of Dad's life, what are we expecting is going to happen?
Right.
What are Dad's expectations?
Right.
What are mine? What are a sibling's expectations? Some people may want a lot, every medical intervention possible all the way to the end.
Yes.
Some may say at a certain point, I am done with medical interventions, just let me have a nice peaceful time for the rest of my days.
Right. And is this the sort of thing that you learned when you were in the hospital with your dad? Is this what you learned the hard way?
Oh, absolutely. All of this I learned the hard way.
Yeah,
which is why I am so mission-driven to
passionate.
Give people information so that they don't learn the hard way.
Right.
And you don't need a lot of information to sort of get started with the awareness of being a family caregiver. I'd never heard the term family caregiver.
Right.
So just to let people know, yes, you are a family caregiver. You have great power. There's a lot you can do.
Right.
And here's some information about that, and here's how to do it.
Yeah. That's such an important point, because I think caregivers don't feel like they have any power, especially once you enter a hospital system and your loved one changes into that robe and people aren't talking to you and you're rushing around. So just taking back a little of that power has to be so wonderful for caregivers.
It is, and when you approach the situation as, okay, the innocent bystander,
right,
and then you realize you need to speak up on occasion or fill in some blanks of information, and especially if you're dealing with somebody who's hospitalized who has dementia, and then you really have to be there to really fill in gaps. And so it's and to leave a person, to be a person where you're with a loved one who has dementia, for example, and you know that they're not capable of managing the hospital stay, for you to take some control over that and help them do that it's a big step.
When you were when your dad was in the hospital, were you there 24 hours, or was somebody there 24 hours pretty much?
Not 24 hours, and this is something else I learned, that so a couple of things.
We're going to hold that thought, because we had to go. We had to stop for a break.
Sure.
But when we come back from the break, I want to talk about that, being there all the time. And you also touched on something as far as speaking up or when to speak up. And I always struggle with this, being an advocate versus a squeaky wheel. So when we come back from break, I definitely want to touch on those two topics. So we are going to take a short break now on Caregivers First, but we will be back shortly with Beth and more wonderful information for caregivers and their families.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, You'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully without setbacks at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
Welcome back to SCAN and Caregivers First. I am your host, Lynette Whitman, Executive Director of Caregiver Volunteers of Central Jersey. And I am having a great conversation with Beth Suereth, who is the founder of Caregiving Pathways. Welcome back, Beth.
Thank you.
So before the break, we were talking about the issue of, does a caregiver need to stay in the hospital 24 hours with their loved one? I think this is always that, like 8 o'clock, 9 o'clock at night comes, the caregiver is exhausted, but you feel like you should stay, but the person might be saying, go home. What's your thoughts on that? What's your advice?
Ideally, a family member would be there 24 hours a day. It's amazing what does happen in the hospital during the night and how many times people come and check vital signs or draw blood even at 11 o'clock at night on occasion. Mm-hmm. So definitely recommend having somebody there as much as possible, but you have to live in the real world and people have jobs and things. So developing a network of people in your family or friends who can cover is really helpful. And it depends on the patient. And again, somebody with dementia, you definitely need to be there more. But you have to sort of work out a rhythm for your family, the exact situation. But, you know, bottom line, be there as much as you can, even overnight.
And if you wanted to stay overnight, is that something that, does every hospital have a different policy about this? Or pretty much if you ask the nurse, I'd like to stay overnight, even when visiting hours are over, how do they decide that?
So I've never encountered a nurse who even suggested that I should go home.
Okay.
I think a lot of times if you are helpful to the patient, if you're helpful to the nurses, they'll encourage you to stay. And so my dad was in a rural Florida hospital, a suburban New Jersey trauma center, and an academic medical center in Manhattan in New York City. And at all of those locations, we were welcome to stay as much as possible. So I think more and more hospitals are realizing that having an informed family member in the room is really very helpful for everybody.
Okay. So this brings me to the point of advocate versus squeaky wheel. And how do you advise families to walk that line so that they're seen as a partner and not as, ugh, Lynette's there again. Hey, what's that line that you advise?
So that line was a learning experience to find that, to learn there was a line and to learn how to walk it. So definitely you want to approach it as being a helpful member of the care team, essentially. So let every nurse know, hi, I'm Beth, I'm here to help take care of my dad. Please consider me part of the care team. Let me know how I can help you as I'm helping him. And so just putting it right out there respectfully, you definitely want to respect their role, their time, their shift changes. You don't want to be asking questions or trying to get their attention when they're trying to change shifts, transfer information to the next nurse on duty, that type of thing. But, and so a couple of other things you can do. Bring them food, bring them candy. They love that. But more than that, most hospitals have a system where you can write some sort of a thank you or recommendation and put it in a box or whatever their system is to let the hospital know how great this nurse was. That's something that goes into their record and that they really truly appreciate and makes a real difference for them in their job.
Right, that's great advice because I think people don't think about that enough, but that really matters.
That really matters.
And I love what you said about saying, I'm here to be a care partner with you and help you with my dad, because shortage of staffing and nurses is such a huge issue right now, and they're dealing with so many patients and bells ringing. So if they see you as a help, I think that would go a long, long way towards towards easing that relationship.
Yeah, and one other thing you can do is wait until they come to your room, because they have scheduled visits. So rather than pressing the buzzer every time you think of a question, write your questions down, because you want to have a notebook to write down everything, and to help keep track of everything. And so when they come in, pick your top 2 or 3 questions, work it in as they're doing their work, and don't overwhelm them with 12 questions. And each time they come in, ask them 3 new questions, that kind of thing.
That's
and
great.
express some interest in what they're doing, and find out about what made them become a nurse. Develop a little bit of a rapport. Sure.
So tell me more about Caregiving Pathways, because I'm thinking people watching this are going to want to carry you in their pocket now. So short of that, tell me about Caregiving Pathways and what you do and how you work with families.
Sure. Through caregivingpathways.com, you can reach me by phone or by email, and I'm happy to talk with you. I do a half-hour free consultation for anybody. Learn what it is that that person is looking for, where they feel they need help, and I can talk about where I feel I can help them, and where I can't, maybe somebody I would refer them to. I have a network of other certified caregiving consultants, but really it can be in person, it can be telephonically, it can be a video conference. I'm completely flexible in helping in whatever way works.
So
really
and all sorts of issues with caregiving, not just the hospital experience, or is it just the hospital experience?
So I primarily focus on the hospital experience portion, but I have a lot of information and lots of lists of resources for different things. And as I said, I can refer people. But also, I'm an end-of-life doula, which means I took training to help people manage really the last pieces of life. And I can help people make an end-of-life plan or start thinking about making an end-of-life plan, which unfortunately sometimes is a piece of a hospital stay.
Yeah, absolutely. Is there a family that you've worked with through Caregiving Pathways that sticks out in your mind, where maybe you pointed them in a direction that they weren't going in? Is there a story you could share about this?
Sure. A fellow, I'll call him Bill. Bill came one day. Actually, I had given him this free guide that is the summation of the information that I like to give to family caregivers from the get-go. And Bill came, and he had notes written all over this, and he said, I can't even tell you how helpful this has been. He really didn't understand that, like I didn't, and who does, when he first arrived, that he had a role, that there were things he could do. And so he was very thankful to have this information, to have the perspective, and he said, this is making such a difference for me here in the hospital with my wife. He was very appreciative, and that's kind of the response I generally get.
That's wonderful. This is a great guide. It's called How to Help Your Loved One in the Hospital. And it's short. It's not long or overwhelming or anything, but it has amazing, really easy to follow tips. And I read it, and I live with my mom who has Alzheimer's disease. And one of the things that I never thought about was writing everything down, having a notebook and writing things down, because I figured I'm in this world, I'm going to remember this stuff. What do I need a notebook for? And then there's so many things that I forget, because I'm thinking about, oh my God, am I taking too much time? What's my next question? Blah, blah, blah. Just writing things down is just a golden suggestion that you give. Yeah, it's wonderful. Yeah. When you were a caregiver for your dad, was there something that surprised you about yourself being a caregiver? Did you learn something about yourself as a caregiver?
Well, I learned that I really, by the sheer force of my will, could do a lot. And if I only learned how to do it properly, which I did, I also really learned that there is a time to let go. and that I didn't need to be in control of everything. So you start the hospital stay with no control whatsoever, and then if you learn and work through it, you can gain some control, really help change things. And at some points, you just can't control it, and you have to let go and not let it make you crazy.
Yeah, and I think that being a partner with the nurses and the healthcare will help that process, because I remember when my dad was in the hospital, nobody was really honest with me that he was probably not going to come off the respirator. So I went in every day thinking that he was going to come off the respirator. Everybody else knew but me. And I think that they just saw me as this desperate, sad daughter. And if I would have developed a relationship maybe with one of the nurses, they would have prepared me for it, but that didn't happen.
And it is helpful to the care team to say, but you need the realization that you could say this.
Yes.
To say, please let me really know what you really think about things, and please don't be afraid to give me bad news.
Yeah. Oh.
And I think that opens up the door for a whole other type of conversation and would lead to helping them prepare you. And again, it's that letting go of trying to fix. So I was always trying to fix everything, bring Dad back to where he had been.
Yes.
But there are times when you need to shift to the next stage, which is just helping guide him through his final days and to really understand what the expectation is medically.
Yeah. Were you an end-of-life doula when your dad was ill, or did that happen afterwards?
All of this, my certified caregiving consultant training, the end-of-life doula training, all came after my dad passed away.
Wow. So I bet there's times that you wish you could just go back.
Lots and lots of times.
Yeah. Do you feel like you said everything to your dad that you needed to say?
I do.
You do.
And that was the whole piece about the end of life. So a physician had recommended a couple of surgeries for my dad, and we knew, he had advanced dementia. He didn't have a good prospect for good quality of life long term. And so it didn't seem to make sense to have these surgeries given his condition. So we, discussed it among ourselves, and you have all those sort of waffling feelings about things. But ultimately, based on what he had always expressed, we decided not to go ahead with the surgery. We took him home from the hospital at that point, or from the doctor's office, I guess, at that point. And we actually had a giant party, which he thoroughly enjoyed. We had different pieces of family come and had parties when they came. We had a party with the caregivers and their families. So we had a wonderful, wonderful time. And I hear from so many people who go the route of, the recommended surgery for somebody who's possibly not going to make it through or is going to have an extremely poor quality of life after, and the regret that they have. So, what I like to say is plan and prepare, or react and regret.
Perfect. Thank you, Beth. Again, give out where people can find you. So it's caregivingpathways.com.
Right.
And then they could download how to help your loved one in the hospital and contact you for further information and resources.
Exactly.
Wonderful. Great information. Thank you, Beth. Thank you, everybody, so much for tuning in today to Caregivers First. I know that I learned things from Beth, and I hope you enjoyed it as well. And now it's your turn. I'd love to hear from you and what's on your mind. Please call SCAN at 732-542-1326 or email us at office@scannewjersey.com and send us your show ideas and feedback. I hope everyone has a wonderful day.